The 2020-2021 executive of the Student Representative Council of the University of Cape Coast has signed a memorandum of understanding with the University of Cape Coast Health Services. At the short event to mark the commencement of the policy that will see students of the University of Cape Coast enjoy some free health services from the University of Cape Coast Hospital, the SRC President, Christopher Datson, expressed his optimism about the project and explained the rationale behind the project.
Okay, thank you very much, TV Ucc. I think that over the years we've had students complaining that when they come to the Ucc hospital, they are made to pay for some services which are not covered by the National Health Insurance Scheme. And so, sometimes they don't have money on them. They are asked to provide money upfront before some services are provided for them. And so, as an SRC, we thought it wise that why don't we commit some funds to cater for this, because when they ask to pay, they later have to go for refunds and it takes forever to come, because the way the system works, it's quite difficult to work on documents and to refund small amounts. So we are putting in a policy to commit some funds to cater for some of these services that are not covered by the NHIS, so that students wouldn't have to pay with their money and later, go for refund and be walking up and down. Looking for their refund. So
on the other hand, Dr. Ucc Src, the director of the Directorate of the University of Health Services, explained the benefits of the policy to the TV UCC crew.
Policy that which even had been in place even earlier. Yes, because with this policy, it spares the trouble of explaining to the students who come in and need to benefit from services that are outside the scope of the health insurance and all that. And but with this policy in place, the students, our job is to take care of the students when they come into the hospital, and it is good when they come in and whatever services could be provided for them could be provided without any hindrances. But with this document, that is well taken care of. X-ray services, eye services, and so on and so forth, and all these are covered by. So that takes away a lot of burden from us. And then on the side of the students too, it makes their visit to the hospital smoother, and they end up getting the impression that the hospital environment is friendlier than because a student coming from far away whose parents are not around, and you need services to be done here, and they are not covered by health insurance. Therefore, you are asked to pay, or maybe you don't have the money. So that makes it easier for the students to access our services in the hospital.
Speaking on the sidelines after the signing of the MOU, the SRC president gave further explanation about the project.
That in the future, and I would implore the next SRC to look at cases where students are referred to other facilities. Students come to UCC, for instance, and they are referred to maybe CCTH for some special scans. I think that going forward, the policy should be opened up to take care of, places or cases like that. I think the policy should be opened up to take care of cases like that.
So going forward, President, what are some of the plans that you intend to implement to ensure sustainability of this initiative?
Okay, so we have written to the Dean of Students, on this arrangement, the Dean of Students, the Director of Internal Audit, the Director of Finance on this agreement. And so we would also implore the next SRC to make sure that when this fund depletes, they also commit some other funds to cater for the next set of services that students will be taking. I think that will go a long way to make sure that this service is still running and it doesn't cease. Yeah.
Now, before we go, do you foresee some challenges that this policy is likely to face?
I don't really foresee any challenges, but I think that it's good we have signed the agreement. That means that all parties are very comfortable with what we want to do. Okay, so when we start it and then there are any challenges, I mean, the fact that we have all come on board to agree to this policy means that we are all ready to work to make sure that we address all the challenges that may pop up regarding this policy. I think for us, for both parties, our concern is that students will receive quality health care. There will be no impediment. So whatever challenges that may come, I believe that since we've come together, we would all put our heads together and work on it to solve any challenges.
This is a great initiative, but when is this policy taking effect?
Yeah, so the signing has been done. So now we are looking at making the transfer into the hospital's account, and then quickly it can quick start. As you know, we have a very short time to hand over, but we are hoping that the processes can be fast tracked before we hand over. But even if it's not fast tracked before we hand over, since the agreement has been made, whenever the transfer is made, the policy will just kickstart. Yeah.
Okay. Now, could this mean that even if a student doesn't have national health insurance card, or have not registered, or have not renewed it, the policy can still take care of the student?
Yeah. So I think that it's important that this question has come up. I want to encourage all students to register with the national health insurance. I think it is free, just behind the hospital administration. The reason why we are making sure that our students register for NHIS is that, of course, NHIS also caters for some of the services. Okay, if we open it up to students who are not, having the NHIS card, within a matter of some 2 weeks, all the funds will be depleted, because that means that from OPD to whatever the student will have to pay. But if the student has the national health insurance scheme, at least that will also take care of some of the things, and then it will keep the fund running for a long time. So I'm encouraging all students to register for the national health insurance scheme. There's a registration office just at the UCC hospital, so let us all try and register. Yeah.
Thanks for speaking with us.
Thank you very much, TVUCC.